everyone, nice to meet you here. During today's lecture, I will briefly discuss about a very common mental health problem, which is the schizophrenia. Schizophrenia is a serious mental illness that interferes with a person's ability to think clearly, make decisions, manage emotions, and relate to other people. It is a complex, long-term mental illness affecting a high percentage of the whole world's population. Although schizophrenia can occur at any stage of a person's life, the average age of onset tends to be in the late teenagers to the early 20s for men and the late 20s to early 30s for women. It is uncommon for schizophrenia to be diagnosed in a person younger than 12 years of age or older than 40 years of age. So we can see that schizophrenia normally happens between 20 to 40 years of age. Now let's talk about the common symptoms of this condition. People with schizophrenia experience symptoms differently from other types of mental disorders. These common symptoms include hallucinations, delusions, and disorganized thinking. What is hallucinations? Hallucinations means that a person could hear voices, see things, or smell things which do not exist. For example, a patient could tell you he or she can see someone telling them to do something, but actually we cannot see that person, so the person is non-existent. So this is hallucination. Or a patient could tell you that he could hear some voice constantly telling him to kill himself, but actually that voice is unreal. So that's a hallucination. Next one is delusion. Delusions are the false beliefs that don't change even when the person who holds them is presented with new ideas or facts. So delusions are the false or wrong beliefs constantly stay in the patient's mind. For example, patient with delusions could tell you that he is the king of the world and he controls everyone. All the people should listen to him. Now, even this belief is very bizarre and this belief is very wrong, but this patient could hold this belief in the mind continuously. So this is delusion, some false beliefs. Also, patient could have disorganized thinking, such as struggling to remember things, organize thoughts, or complete tasks. So patient with schizophrenia, they feel very difficult to organize their thoughts. And they could not even manage a simple task in their daily life. Additionally, patient could have some negative feelings, or when they talk to people, they always speak in a dull, disconnected way. They could not maintain a good relationship or maintain a good communication with other people around them. Sometimes the patient, when they talk, now they could jump from one topic to another topic really quickly. So they have really the fly ideas, fly topics in their mind. So they cannot focus on one topic at one time. So they always have jumping topics and talk in a disorganized way. So people feel really hard to pick up their opinion. Now let's talk about the causes. So what caused the schizophrenia? The first one is the genetics. Schizophrenia is highly related to the family history. Schizophrenia occurs in generally 1% of the whole population. So having a family history makes this patient have high vulnerability to this condition. Schizophrenia occurs at roughly 10% of people who have a first-degree relative with the same disorder, such as a parent or a sibling. So we can see that family history plays a significant role in mental health conditions. Next one is the environment. Exposure to viruses or malnutrition before birth, particularly in the first and second trimesters, has been shown to increase the risk of schizophrenia. Also, inflammation or autoimmune diseases can make the patient have high possibility of developing this condition as well. Also, brain chemistry. Now, we know that in our brain, we have a lot of brain cells. Now, these brain cells have to send message to other brain cells and to connect to each other to maintain a normal brain activities. Now, there's some substance called neurotransmitters released in the brain to help the brain cells to send message to each other. Now, these neurotransmitters are called dopamine, serotonin, and glutamate. Now, these are some common and important neurotransmitters. Now, when the neurotransmitters is not released enough inside your brain, then the brain cells could not maintain a good activity. The brain cells could not send message properly to each other. So the brain activities could be affected and patient's mood could change as well. So reduced amount of neurotransmitters is another major reason for the schizophrenia or other types of mental illness as well. Now remember, certain neurotransmitters, especially dopamine, serotonin, and glutamate, now they plays very significant role in managing patients' mood, controlling patients' emotional feeling, and connecting and helping the patient to feel pleasure, to feel happy with a sense of pleasure. So if these neurotransmitters now reduce in amount, the patient could suffer disorganized thoughts, suffer schizophrenia as well. Then another major reason is the drug use. Some studies suggested that taking drugs during teenager years and young adulthood can significantly increase the risk of schizophrenia. Now these days, especially like young people or immature teenagers, some teenagers, because they have immature mind, so they could buy the illegal drugs and use these illegal drugs, especially marijuana. So now these drugs, when being taken, they can affect the brain activity. They can change the release of the neurotransmitters and make these neurotransmitters in your brain become unbalanced, and then further affect the mood, affect the thinking of the people. So again, we can know that drug use is a major reason for development of certain kind of mental illnesses and even schizophrenia. Next one, we're going to talk about the diagnosis. Diagnosing schizophrenia is not easy. The difficulty of diagnosing this illness is compounded by the fact that many people who are diagnosed do not even believe they have this condition. So lack of awareness is a common problem of people diagnosed with this condition. Now, to be diagnosed with schizophrenia, a person must have 2 or more of the following symptoms occurring persistently in the context of reduced functioning. So these symptoms include delusions, hallucinations, disorganized speech, or disorganized behavior. So if you have 2 or more of these symptoms, you need to consult with your doctor and quickly get diagnosed. The last one, we're going to talk about the treatment. So there are different kind of treatments, including psychotherapy, psychosocial treatments, and antipsychotic medications. Now, with people who have schizophrenia, firstly, we can let the patient to try some natural therapies, such as attending some community services programs. Some community services organize the social activities, discussion groups, which can help the patient to participate in more social activities, and by letting patients to sit together with each other, they can help the patients to communicate with each other and express their feelings and understanding more about this condition. So encouraging the patients to attend more social activities um, is a good way to help the patient to build up more confidence, build up more communication with other people. Also, we can let the patient to try psychotherapy. Psychotherapy include mainly cognitive behavioral therapy or cognitive enhancement therapy. Now, cognitive behavioral therapy in the short term CBT is very commonly used for different types of psychosis. Now, cognitive behavioral therapy now normally works by changing patients' negative thoughts into positive thoughts. So this therapy, CBT, now works by converting patients' negative feelings into positive feelings using different type of strategies. So it's very commonly used for patients. So if you have a family member who have schizophrenia, you can refer this patient to the psychologist, and they could organize these psychotherapies. If all the natural treatments were failed, then last choice, we can use the antipsychotic medications. Medications should be taken as a last option because they have major side effects. All the medications have side effects and could cause toxicity if we use it overdose. So now some antipsychotic medications works normally by balancing the amount of neurotransmitters released inside the brain to help people to maintain a better mood and better sense of feeling. Due to lack of awareness of having an illness and the serious side effects of medications, again, people who have been prescribed them are often very hesitant to take them. So some people, especially elderly people, they could refuse antipsychotic medications because they don't have enough knowledge. Therefore, as a nurse, we have to provide detailed education to our patient to let them to have good knowledge about the medications, how they work, what are the functions, and what are the possible side effects. So this is very important. So education is extremely important for patients to always have good knowledge about their own condition. Thank you very much. I hope this little lecture could help you to have a better understanding about the schizophrenia. Thank you.